A report into conditions at NGOs where the remaining Esidemeni patients are being accommodated will be handed over to the National Health Minister and Gauteng Premier early this week. It follows the death of 94 psychiatric patients at NGOs with invalid licenses, poor resources and untrained staff. The tragedy has thrust the critical role of NGOs under the spotlight, and many continue to offer life-saving care.
Human beings.
A forgotten people. Often stigmatized, ridiculed and cast away. Suffering from bipolar or mood disorders, schizophrenia or anxiety. The youngest, 24, the oldest, 65. In most cases, relatives are unable to provide adequate financial, emotional and psychological care.
Because we're not there, because she needs the guidance, it makes me feel guilty that I'm looking at someone basically wasting away. Somebody that could possibly do so many things. She's artistic, she's bright, she's intelligent. So for me to watch that waste away is just not working.
They found it impossible to look after their child and to earn a living to be able to afford to look after their child. It's a very traumatic existence for the whole family to have a son or a daughter or an uncle or whoever who is not stable, who is psychotic.
Tandinani Care Centre, a home away from home.
Psychiatric disorders are not a barrier here. It's a creative, stimulating and social environment. Apart from drama, art and poetry classes, they also learn to understand their own and others' disorders.
And self-acceptance.
What we're trying to do here is get the residents to own their disorder and remove the stigma that they have against themselves. We don't treat them as if they're mentally ill. We treat them like they are people with this other thing, this disorder, but they are not the disorder. They are people.
The strained public health system relies on places like this.
NGOs can play a crucial role in supplementing the public sector services, and if they are properly regulated and adequately funded, they can really provide an excellent service.
Tandinani is a success story, supplementing a government subsidy with donations and proceeds from craft works, well-managed and trained staff. The proposed review of licensing regulations of NGOs with psychiatric patients will go a long way towards nurturing this vulnerable group. Gillian Pillay, SABC News, Florida.